missing. The way I came up in my life, I knew I had to listen. I told myself I never stop, and now I'm on a mission. The way I'm killing it, I know you really feeling it. My flow is like a weapon, no concealing it. I feel like Kaepernick and my brothers who I'm dealing with.
So we have Ms. Sheila Campbell, who is a kidney smart educator. You're never too young to develop kidney disease. Some of you might think it could not apply to you, but it could. So please give her your undivided attention for a few minutes. If you can't use this information, take it back to your relatives, to your churches, and your communities.
So when we think about kidney disease, 1 in 7 people have chronic kidney disease in this country. Over 30 million Americans. When we're looking at specifically with African Americans, are 3 times more likely to have kidney disease. 35% of all patients in the U.S. on dialysis are African Americans. So the reason I'm here today is just to speak about diabetes, hypertension. These 2 are the main causes for kidney failure. We have a lot of educational opportunities online in the community. The first steps are to make sure that your blood pressure is in range. So I'm here to speak to you today to encourage you to take the next step in your life with your health. Be an advocate. Eat healthy. Don't go to fast food restaurants. Shop on the outside of the grocery stores, because all that food is doing is affecting your bodies internally.
I'm Dr. Hakmi. I'm a kidney doctor. I work here in town with Dr. Nazir, Dr. Durham. I also work with Dr. Ross at the Dialysis Access Institute. I think you guys heard already some statistics and information about kidney disease. Older generations are kind of screwing with our history, with our future, I mean, healthcare-wise, with all the mess that's going on with the healthcare laws. So it might be difficult, but it is very important to keep an eye on your health. Make sure pain medicine, over-the-counter pain medicine, that's a big one, is a damaging thing to your kidneys. So Tylenol is the only thing I would say is safe as far as the kidneys go. So if you, especially for athletes, those aspirin, the Advils and the Aleve, too much of those can harm your kidneys.
Tracy Sanders is an attorney, author, and speaker in Los Angeles, California. She is the founder of the Natural Hair and Law, which is an organization formed to provide publications, workshops, and events addressing legal issues related to natural hair in the workplace and school.
So my first question to you is, what is natural hair? Anyone? When you hear that term natural hair, what does it mean?
The hair that naturally come out your scalp.
The hair that naturally comes out of your scalp. So my book is entitled Natural Hair in the Workplace, What Are Your Rights? I wrote the book because I'm recovering from alopecia. Alopecia is a condition that is either genetic or it's caused by hairstyles. So you all told me what natural hair means. Natural hair is a hair that is growing out of your scalp. Under the law, if your hair has a perm, it's still considered natural. But in the black community or the texture community, we think that color, dye, relaxers, any of that means you're not natural. However, how many of you know it's all about personal choice? You can define your own natural. Honestly, if we have 4 candidates applying for a job at a bank, 3 have locks, 1 has straight hair, who do you think the bank manager would hire?
The one with straight hair.
And tell us why.
And the reason is that with our texture of hair, some of us have good hair. I shouldn't use good hair, but hair that's not so kinky. And when you wear the style of dreadlocks, it could either look neat on you or it could look a mess.
Did you all hear that? She gave you the honest response that an interviewer would not. The truth of the matter is you will face discrimination based on your hairstyle. Number 1, as Cynthia stated, a lot of employers feel that certain hairstyles are unprofessional. Did you all ever hear that term? A lot of employers feel that locks are unkept or they will make a negative presentation in terms of business image. Now, according to the law, an employer can actually discriminate. An employer can say, I choose you, but I will not choose you three because I do not like your hairstyle. Do you think that's fair? No. Then how many of you are planning to go to law school and help change that law? We need you to. Before you sit down, if you have straight hair, is that in its relaxer, is that natural? So isn't it unfair that she is not natural, but because it's straight, it would be considered a preferred professional hairstyle? If you have hair that you can straighten, this is a good example of a race-neutral hairstyle that anyone can wear. Get the job, do a great job, wait at least 3 months after the probation period to change it. But I am going to end now with 5 tips to help you navigate natural hair in the workplace. Number 1, when you are employed, follow the dress and grooming code, okay? If the workplace is not for you, don't go and break the rules or it won't end well. The second tip I have for you is review the workplace anti-discrimination policy. So the first thing you should do when you're employed is review your employee handbook. Number 3, understand state and federal law. You have rights. No employer should discriminate against you based on race, color, sexual origin, or any other protected category pursuant to the United States Constitution. Number 4, if you feel you've been discriminated against, contact the Equal Employment Opportunity Commission.